Good afternoon, everyone. Thank you for coming to this session on waste management and open burning. Really pleased to have everyone here. This is a topic that I really love. My name is Sandra Cavalieri. I work for the Climate and Clean Air Coalition Secretariat, and I coordinate the work that we do across our 6 sectoral hubs, waste being one of them. And I really appreciate the invitation from Pier Paolo to join today. I wanted to start with a question. So everybody who composts at home, please raise your hand. All right, and for all of these that don't compost at home, it's really a very fulfilling, satisfying activity to take your vegetable and fruit and turn it into like beautiful soil that you can use to even have your like potted plants. I don't think you need a lot of space. And so if anybody is interested in seeing my voluntary black soldier flies after this, I have a little video and I would be happy to show it to you. I live in Maryland and they came all by themselves to my compost, and they're seasonal, so they don't hang out in the winter, but they do seem to come back every summer. So I really, really recommend you think about home composting. All right, so waste. Why are we talking about waste? So waste has really made it onto the radar, and there are a lot of good reasons for this attention. So here are some statistics that you may already know, but if you don't, you're gonna be shocked, so get ready. The world generates over 2 billion tons of municipal solid waste each year, and globally, 40% of waste is burned. So that's a lot, 40% of waste is burned. And there are higher percentages in low and middle income countries. And globally, 33% of waste is openly dumped. And this is mostly because there's a lack of comprehensive collection systems and proper waste disposal sites. Waste might be deliberately burned also to free up space at dump sites and to facilitate scavenging of materials such as metals for profit or for use as a heat source. In uncontrolled landfills and dump sites, waste may also spontaneously combust as a result of a combination of factors, including the emission of flammable methane gas from biodegrading waste. And that's why it's really important to get organic waste out of the landfill and also just no new landfills. It contributes to a range of global and localized problems, from toxic air pollution, harmful for people's health, causing respiratory and cardiovascular ailments, and for the environment, from soil and groundwater pollution, from leachate and ashes, inhibiting plant growth to climate change, ranging from plant growth to climate change. And there's a risk of sparking wildfires and related air pollution and loss of biodiversity. So some of these problems are not measured and well understood, and at the same time, on the more sophisticated end, we have satellite imagery that's now able to make super emitting sources of methane emissions visible. And we at the CCAC are really advocating for like measuring these emissions and then acting to mitigate them. The CCAC, or Climate and Clean Air Coalition, has a keen interest in this topic because of the waste sector's emissions are SLCPs, so their black carbon and methane are coming from this mismanagement. And waste currently accounts for 20% of global anthropogenic methane emissions, and it's the fastest growing source. Short-lived climate pollutants are double agents, so they're affecting both our climate and our air. And their high global warming potential and shorter lifetime make their reduction critical to keeping the 1.5 degree target alive. So addressing open burning is an immediate priority. Bans on open burning area and tailpipe of measures needs to be enacted now. But since inadequate waste management is at the heart, we also need to address the issues in a more holistic manner. Avoidance of waste in the first place, spurring circularity. So even, it's important to say that even managed landfills are not a panacea, and we need to keep in mind that all biodegradable waste landfilled today will continue to generate methane for decades, and there's a technical limit. So only a maximum of 50% of landfill gas can be captured by gas collection. So landfills are not a solution. And so having laid out the reasons to act, I want to emphasize that there's no reason not to act. As much as 60% of the waste sector targeted measures have negative or low cost. According to the Africa Waste Management Outlook report published by UNEP in 2018, 70 to 80% of municipal solid waste generated in African cities is recyclable, with an estimated economic value of 8 billion per year. And literally all the measures come with a strong case for action from a social economic perspective, from waste of resources to pollution. So there's accounting for lost days of work due to air pollution. Also, there's an impact on household health and safety and livelihoods of the informal sector of workers, especially women. And in a minute, we're going to see a video that really explains that. And on the latter, there's evidence of problems for mother and children's health from exposure, dioxins in breast milk, and there's also been linked to, this has also been linked to the proximity that people live to incinerators. And so limited decision-making power means that policies often fail to consider gendered needs and safety concerns. So we really need to engage the communities, including with training and building safety nets and addressing informality. We have no time to lose as the trend is going in the wrong direction. Global waste generation is expected to grow from the 2 billion tons today to 3.4 billion tons by 2050. And we need to build on the political momentum and create a movement by building awareness and communities. We have concrete actions that are proven to protect both the climate and human health, and we must implement them at scale. The CCAC has been working with its partners to prevent the open burning of waste by sharing best practices on waste management and assisting countries and cities to adopt policy and regulatory tools that would lead to the decrease of open burning of waste, as well as preventing fires in dumps and landfills. We are providing support to governments such as Benin, Morocco, and Togo, and we have a large project also underway to measure and prevent open waste burning in the regions of all Africa, Asia, and Latin America. We're also a member of a multi-stakeholder partnership to eliminate open burning, and this is to support implementation of an AMSIN resolution to eliminate the open burning of waste in Africa. We also have a large project to develop models of integrating the informal sector workers into organic waste management and demonstrate the scalable feasibility in various countries. And through our CCAC Waste Hub, of which you're all invited to join, we offer matchmaking and knowledge sharing. We've also launched a new initiative with Oxfam America, where we're providing governments and civil society with tools required to integrate gender considerations into super pollutant mitigation projects. And so our main message is that we want to work together, we want to foster collaboration, and work to create, to kind of turn around this dilemma on waste. And without further ado, I'd like to, we'll see one of these videos, maybe just one. And yeah, let's watch that now. No? Okay, hold on.
Ah, lo haré ahora mismo en QuickBooks. Solo necesito...
सबभन्दा पहिलो चुनौती एउटा पहिले हामीले गर्नुपर्ने भनेर पनि गर्न नसकेको कुरा चाहिँ वेस्टको सेग्रिगेसन नै हो जस्तो मलाई लाग्छ है अझैसम्म पनि हाम्रो
र दैनिक जीवनमा एज अ वाइफ एज अ मदर एज अ डटर मैले चाहिँ जुन भूमिका निभाउँछु बिहानदेखि हामीले उठ्दादेखि निस्किएका फोहोरहरू जेनेरेट गरेका फोहोरहरूलाई वास्तविक रूपमा हाम्रो त्यो सेग्रिगेसनको भनौँ छुट्याउने अझै पनि त्यो प्रविधि बनिसकेको छैन र हामी अझै पनि त्यसमा अभ्यस्त भइसकेका छैनौँ तैपनि हामीले एउटा सानो घरबाट पनि हामीले एउटा छुट्याउने मैले चाहिँ छुट्याएर एटलिस्ट छुट्याएर मात्रै पनि फोहोर लिन आउनेलाई दियौँ भने केही त सहज हुन्छ उनीहरूलाई काम गर्नलाई भनेर छुट्याउन थालेको छु र म मात्रै होइन मेरा छिमेकीहरूलाई पनि
यो अहिले भइरहेछ हाम्रो यो यस्तो मल फोहोर व्यवस्थापन गरेर अहिले सरसफाइ अभियान पनि चलाउनु भएको छ यस्तो गर्यो भने राम्रो हुन्छ मैले गरेको छु अब यो सामानहरू सबै व्यवस्था गरेर कुहिने एक ठाउँमा नकिने एक ठाउँमा गरेर अनि टोलमा अरूलाई पनि यसो गरेर गर्नुपर्छ भन्ने सिकाएको छु
I think men should also be equally involved because if women do everything and the men are not aware of the waste segregation and waste management, I think this whole issue of tackling the waste is not really met.
I think that the only issue we have is to make men understand that waste is equally their problem to not only women, because in the past it has been the norm that women do the household chores and the cleaning up and managing the waste or throwing the trash. So what I could do is participate equally in the household chores and gradually make my children also understand that cleaning the house and doing household chores is not a gender specific rule. It can be taken up by anybody, not just the female.
All right. So I think that gives us a really nice framing for thinking about the next four speakers, and what they're talking about is actually about people and about people's lives, and it's a really important sector also for gender equality and for thinking also about socioeconomic equality and fairness. Our first speaker is Cara D. Wright, and Cara D. Wright is a Chief Specialist Scientist at the South African Medical Research Council, leading the Climate and Health Research Program. She's an adjunct professor at the University of Pretoria and UJ. Her research focuses on climate change, air pollution, environmental health, and policy development in Africa. She also studies solar UV radiation and skin cancer prevention. With over 200 peer-reviewed articles, Dr. Wright contributed to the WHO Air Quality Guidelines, IPCC, UNEP, and is a technical advisor to the WHO, ILRI, HEI, and other organizations. And she was named a 2024 NIH Climate and Health Scholar, which makes me sad and happy at the same time. So we're going to listen to Cara D. present to us about waste burning and challenges and opportunities in low and middle income countries. So thank you so much.
Thanks, Sandra, and thanks everyone for hanging in there so late in the day, middle of the week. I'm going to start with a very quick piece from the news. So bear with me, it's not long. An inquest has been opened into the death of a 4-month-old baby who died on Saturday after he was bitten on the head by a rat. Nkosi Twaka, who lived with his parents at the Kennedy Road informal settlement in Durban, was bitten on Friday but died on Saturday because his parents could not afford to take him to a doctor or to the local clinic, which happened to be closed on the weekends anyway. His mum, aged 22, said she and the baby had been taking a nap when she was woken up by the child's cries. She said she had seen a huge rat bite in Nkosi's head and took the child into her arms, but the rat would not let go. The rat eventually let go of my child's head, and the right arm were bleeding from the bites. We were waiting for the clinic to open on Monday, but Nkosi died on Saturday. According to the president of a shack dwellers movement in the community, he said that shack dwellers and our children are not looked after. Rubbish is not removed, which provides a breeding ground for these rodents. The eThekwini Health Department said that rats were a problem across the entire city and that they were failing to get the waste removed, which was a key reason for these incidents to be occurring. That is a rather striking story, but not uncommon in media in South Africa and other low and middle income countries around the world. Without repeating too much of what we've already heard in the introduction, it would be important to state that even in LMICs, waste is a major contributor towards greenhouse gas emissions, but it is also a health hazard in terms of the air pollution when it is burned. This open burning occurs in dump sites, so formalized dump sites, in formal landfills, but also in informal settings, such as in residential areas. In the science and policy snapshot that we've been working on with the WHO, which will come out imminently after the conference, there's a real need that's expressed in that SPS to decrease open waste burning for several reasons: for cleaner air, for cleaner energy access, for climate change mitigation, but especially for health and well-being, including things like rat bites. So what do we know about the evidence? And this is thanks to my incredible team in South Africa at the South African Medical Research Council. The WHO asked us last year to conduct a systematic review on the health impacts of waste burning at a global scale. So what we've done, and encouraged by the WHO, we've done something a little bit differently. And you'll see here, this is the traditional, if you can just go back to the first slide, this is the traditional approach where you wouldn't believe there were 22, oh, is it me? Go back, there we go. 22,000 articles that were retrieved, and my team has meticulously gone through to try and identify studies that have looked at the burning of residential waste and impacts on human health. And believe it or not, they've got down to about 25 studies that have actually looked at residential settings and health impacts. But what the WHO asked of us was, could we please do this in a different way? And so we've also applied a machine learning approach, bringing together the scientists from my team as well as data scientists from another university. You'll see there that they've been using different word terms and classifications, and amazingly, they're finding a 70% match in the articles that are being retrieved compared with the traditional approach, which is fantastic. So what are some of the health implications for people living nearby areas where waste burning occurs? So these risks include lung and heart disease, cancer, infertility, several birth outcomes such as low birth weight, premature birth, cognitive development problems. Should also mention things like skin pricks from medicinal instruments and such on waste sites, as well as symptoms such as chest pain, coughing, congestion, skin symptoms, as well as the more serious things like respiratory and cardiovascular diseases and thyroid dysfunction. Now, these health impacts are known to occur, and we probably see these in high-income countries where waste burning is probably more controlled, and this type of evidence is well gathered and synthesized, but certainly in LMICs, it's very difficult to find the data to prove that the or at least to show associations, that the impacts of the burning of the waste is having a real effect on the health of individuals. So this takes us to what I guess I would speak to the challenges of dealing with open waste burning, particularly in residential areas. Some of these challenges are that, to start with, as I explained in the case of the child who passed away from the rat bites, there is very poor or non-existent waste collection. In some instances, waste may be collected once a month, which is clearly insufficient, or not at all. There is no household separation of waste. The reality is, and I live in a suburban area in a reasonably established part of Pretoria, the city of Pretoria near Johannesburg. I used to separate my waste, but there is no mechanism for which I can take my waste that I've separated anywhere. So I have to put it out with my general waste, and when I do, there are 10 to 15 men and women waiting to take my bins, and they literally just open all the bags and shake everything back out, because they are our informal collectors, sifters, recyclers, and they take what they want and what they can retrieve for money. And essentially my efforts to try and separate are in vain. I mentioned this too, that there's no curbside recycling mechanism that we can use. There's also the challenge that we don't even have a handle on the composition of our waste. In many LMICs, we don't know what waste is being generated in what proportions, so how much effort should go towards recycling, how much effort should go towards encouraging things like composting. And in addition to that, there's some very serious challenges around the social and environmental inequities that are related to waste and the burning of waste. This tends to occur in informal settlements where this waste collection problem or waste management problem is a problem. And this turns into a very real environmental justice issue. At the same time, people have to make health choices. So many families will live nearby, even illegal, so to speak, not that all countries legislate waste, but illegal dump sites, which are informal, where burning might occur when dangerous waste is identified. But at the same time, the health choices that pickers or the people who go and sort through the waste at these sites make, they are making a health choice, putting their health in danger to go and find resources to use to be able to provide for their livelihoods. So what are some of the opportunities when it comes to low and middle income country municipal waste in residential areas to try and eliminate this waste burning? I think this was already mentioned, but about 70% of this waste is recyclable. It includes things that are biodegradable, a lot of plastic which can be recycled, as well as paper. It is worth something, and we've got to think of this in the context of a circular economy. We need to be able to prioritize reuse. In my country, I'm noticing a lot more things coming in, products coming in glass, which is great because I can use the glass jar for numerous other purposes. That takes a shift in the commercial world to think about different packaging. Recycling and recovery, strengthening the local manufacturing opportunities to create jobs using recycled materials is another way to alleviate this waste going to an illegal or an informal waste dump. Then to try and encourage employment. So as much as those curbside sifters or pickers are going through the waste and they are dragging trolleys tens of 20 kilometers across the city to collection points where they can then hand this waste in to get funding, this is not really occupationally safe employment for these people. How can we make sure that this is supportive and inclusive and ensure that they are safe at the same time. We do need to think about phasing out these, not necessarily phasing out the informal economy, but trying to incorporate them into a way that we can ensure that they are safe too. There are definitely economic, social, and environmental, together with health benefits, that come with separation and recycling of waste as secondary resources. I think we should also think, and this is me to wrap up, that we do need government policy. In many low and middle income countries, there's very little prescribing what needs to be done to deal with the waste, to avoid this waste being burned. Decentralized waste burning absolutely has to be deterred. What we are seeing even from our 25 studies is that there are health implications of burning waste in residential areas. There are opportunities to think about things like subsidy, return of glass bottles for a reduction in price on the purchase of the next one, incentives, some of these amazing incentivized projects in countries, in low and middle income countries, where if you return a certain amount of a waste category type, you get a food voucher, for example, or seeds to be able to plant in a garden. And two underlying things, thinking about the underlying objectives that really drive these challenges, from the lack of waste management and waste collection all the way through to the individual, and how partnerships and community engagement can really help. And this would also include some very strong messaging to communities on how we can eliminate waste burning, reduce the waste, and try and protect our people so that we don't have incidents like I mentioned at the beginning. Thank you.
Thank you so much, Karadi. I think that the exchanging waste for food vouchers and seeds is really feels like a positive way forward. Our second speaker is Andrea Costa Santos, and I know Andrea from many years ago, so really happy to see her again here. Andrea is an economist with a PhD in health economics from the London School of Hygiene and Tropical Medicine, where she worked as an assistant professor from 2008 to 2019. She has over 20 years of academic experience in economic analysis, specializing in priority setting analysis to tackle infectious and non-communicable diseases. Since 2017, she has supported the World Health Organization and the World Bank as a consultant by providing economic statistics and arguments for investment cases of environmental issues, including capacity building in countries of all income levels, especially Africa and Latin America. And currently, she is an associate professor in health economics at St. Mary's University in London in the United Kingdom. And I'm really looking forward to hearing her share information with us about health and the economic burden of e-waste burning in Africa. So, Andrea, over to you.
Buenas tardes. Can you hear me well? Yeah, buenas tardes, good afternoon. Thank you so much for the opportunity to share our work. As Sandra said, my name is Andrea Santos. I'm a health economist, work as a consultant for the World Bank and also for the University of St. Mary's. Today, so I'm presenting this work on behalf of my co-authors. This is another, it's okay. I had changed the title because the title should reflect a bit more precisely what you're doing. So you're doing the health and economic burden of acute respiratory infection for children below under 5 years old, attributed to e-waste burning in Africa. So that's a more precise title. So I just wanted to give you some context for our study and for why we conducted that and how we conducted that, this study. So e-waste is a fast growing. E-waste stands for the electric and electronic discharge of these products. And so it's a fast-growing environmental and health issue around the world for countries of all incomes. In Africa, the production of e-waste is relatively small compared to other countries. But the issue is that they are importing second-hand e-waste, second-hand products especially from Europe. And these products, they no longer pass European standards. So they are being used and dumped in the landfills in Africa. In addition, the discharge of the waste that come from high-income countries are being dumped in many African countries. So it's a growing problem, and that they are facing this challenge without the infrastructure. So we have some studies showing that the environmental impact of e-waste in Africa. We have some studies showing the health impact of the e-waste in Africa, but the studies that we have available is with a small sample size. So we cannot extrapolate the results for the entire population. So we don't know the impact of e-waste at the population level. So we know for a specific group for e-waste workers, but we don't know at the population level. So the World Bank has the interest in understanding what's the impact, the health and economic impact of e-waste at the population level. We trying to think how we could do that without primary data collection. So we have what we call real world evidence, that we collect data, the existing data, to show the impact of e-waste. We decided for acute respiratory infection because children is the most vulnerable group affected by e-waste. As we discussed yesterday, we know that children, the immune system of children they are more vulnerable, but also they inhale higher volume of the air. So that's they are more exposed to the effects of e-waste. And you also know that e-waste dump site, they tend to have higher levels of pollution compared to any other dump site without e-waste or any other background areas. For example, high traffic areas for vehicles or any other dump site. So you know from the literature, you have evidence for the literature showing that e-waste dump site, they have higher levels of pollution. So what we did using available data was to take the data from the Demographic Health Survey, the DHS, that funded by the USAID. We took data from the DHS because they provide the data at the level of the population through GPS, so you have data from individuals and the household with the children. And we collected data, we identified the different e-waste dump sites in the countries identified through the GPS. So we combined this data, and we separated the group of children for different areas. So close to the e-waste dump site, so there are people living within 5 kilometers of the waste dump site. Children living with between 5 and 10 kilometers from the dump site, and the children living between 10 and 20 kilometers from the dump site. So for us to understand what's the risk of acute respiratory infection for children living close to the dump site and far from the dump site. So for us to have this comparison. So we estimated what we call a prevalence rate ratio. That's quite similar to what we have relative risks. We estimated the prevalence rate ratio in 1.7. That means children living close to the e-waste dump site, they have 70% higher risk of having acute respiratory infection compared to children living far from e-waste dump sites. And to demonstrate our framework, we collected data available from the literature on the levels of air pollution. We had data not for all the countries that we looked at, but you have data from Accra. So what we did, we collected data from the main US dump site in Accra. I'm going to call it Agbo because I don't know how to pronounce the name, but so I will call Agbo. So we have some studies showing the level of air pollution in that US dump site. And as you can see, the level of air pollution for that site is more than, sorry, it's way than white. Yeah, 88 micrograms. And we took also data from different other points. So you have 2 other points within the metropolitan area. And then you see the levels of air pollution. So these different metropolitan areas, you have dump sites without e-waste, you have high traffic areas, so you have people burning waste in the streets, so that's all these areas. What you could see is that children live close to the waste dump site. The prevalence of acute respiratory infection was, from the DHS database, we're estimating 5%. Those who are far from the US dump site had 2.5, it was half of the risk. So we could triangulate the data to show living close to the waste dump site is a higher risk. Having this information, we estimate the number of cases of acute respiratory infection that would happen in 10 years. Sorry, not 10, 11 years, because if you calculate from 2022 to 2032, it would be 11 years. So we estimated that, sorry, that's why I changed the slides. We estimated that in 685,000 episodes of acute respiratory infection would happen if you keep that risk of the risk of disease, of disease. And the number, let me just go back a bit. How can I go back? Sorry. How can I go back? Okay. Sorry, I sent Javier Paul. I asked him to, so it's okay. So, and then sorry about that. Anyway, I will continue. So, so what we saw, that's more than 600,000 cases of acute respiratory infection would happen between 2022 and 2032, and more than 275,000 of pneumonia cases would happen at the same period. We also calculate the costs of having these diseases during the same period of time. As in the US, as you can see, the morbidity cost would be more than $19 million, and the international money would be, that PPP, would be almost 50 million in international dollars. The cost of mortality would be, of course, much higher because you are counting for the loss of the child life to the life expectancy, average life expectancy for the country. Mortality costs would be more than 94%, while the morbidity costs would be 6%. But one thing that I want to call your attention is that if you look at the morbidity costs for the public health sector and the households, you can see the households is paying almost the same costs as the public sector. So it's almost 50, it's just a little bit more for the public health sector, 56% of the total costs, and for the household is bearing 44% of the total costs. It's a lot. And I know that the numbers, if you are, if you're high-income countries, you are very used to the billions and the trillions in terms of losses. But if you put this number in perspective, this loss for the morbidity costs could train, if you take into account that to train a medical doctor in Ghana costs about $30,000 for 5 years. If you take that money, because it's money paid by the private sector to treat patients with acute respiratory infections and pneumonia, it's cost to the household to have a child sick at home. So they are losing money, and they are paying out of pocket, catastrophic, because most of them work in the informal sector, so they depend on the ability to go to work. So this is quite serious. So if you take into account, for example, just putting this number in perspective, if you assume that in Ghana to train a doctor for 5 years, to have a doctor trained in 5 years, costs $30,000. So if this money could be averted, you could be training more than 600 doctors. And if you take the average cost to train a doctors in these countries, you'd be more than 1,000 doctors that you could be training, just looking at the cost of morbidity that you are losing. So what would be the way forward? It's, of course, urgent to protect the children, that they are the ones that are suffering. It is just here, you're covering the case of acute respiratory infection, but my colleague Ernesto published a paper on the Lancet showing it's general, it's about lead, but lead is also linked to e-waste. Showing the effect, the tragic effect that lead has on children development, cognitive development, and it's tragic. That's really tragic. So you urgent need and interventions to control e-waste in countries. You also need data. We had someone saying, oh, you don't need more data, but you definitely need, especially in this area, we need data because we don't have data in low-income countries, in low and middle-income countries, to support advocacy, to make the case for investments. And we need data not only for a specific sector, but to speak the language of different sectors, because it affects not only the health sector, but affects the Minister of Environment, all the many sectors, industry, agriculture, finance, everyone needs to come together for these issues. And definitely we need primary data collected at the country level and understand the different type of emissions. We need monitoring of the emissions because the papers that I showed, I will not go back, otherwise we could have a problem. But when you show that picture from Accra, we could see the emissions that they are focused was on the PM 2.5 and the emissions of volatile organic compounds, but there are papers showing that the composition of the emissions are, you have a cocktail of pollutants. You have heavy metals, you have dioxins that can persist in very small particles and travel really far away. So it's not if you have mitigation strategies, it's not necessarily the mitigation strategy that's available for one country, you do work in another one. So if you don't have the data, what's the emissions is happening in that country, maybe we are just throwing away money if you have any kind of intervention. So you really need to understand what's going on in the country. So thank you very much for the opportunity again to present our study. And I just want to say thank you to my colleagues. You just pass it. Sergio, Ernesto, and Stefan. Thank you very much.
So thank you, Andrea. I think all of us are probably sitting here thinking about what can be done to prevent these dump sites in the first place. And I think that's also this comprehensive management that a lot of people are working on in the region. So really trying to prevent the problem in the first place. Thank you. The next speaker is our colleague Agnes Nyabigambo, and she is from Makere University, Makakeri University in Uganda. Agnes is a health services research specialist, and she holds a Bachelor of Science in Nursing and a Master's of Health Science, Sciences Research, both from Makakeri University in Kampala, Uganda. And she is a research associate and project manager currently at the School of Public Health, and she works for the Resilient Africa Network. And welcome, Agnes. Agnes is going to speak to us about open waste burning and landfills specifically in Uganda. And so we look forward to learning about that. Thank you, Agnes.
Thank you so much, Sandra. And I would like to thank WHO for giving us this opportunity to share our experiences. Not here to share data, but to share the real lived experience of the effects or the impact of open waste burning and landfilling, which is a silent threat in Uganda. Open waste burning accounts for 11% of the world's black carbon emissions, with 26% of waste incinerated domestically and 15% in landfill sites. This practice contributes approximately 5 to 12% of the overall greenhouse gas emissions, while methane released from decomposition of organic waste accounts for about 20% of the global methane emissions. Moreover, it is a significant source of PM2.5 pollution, contributing nearly to 1.2 million premature deaths annually in Africa. However, for Uganda, there is barely any research or publications in this area. So it's a silent burden that is affecting. How Ugandans are burning open their way to the grave. This was one of the headlines in the newspapers. Open burning causes toxic exposures, as already mentioned, and burning of waste is typically alongside the roads. In the evening, as you're moving alongside the roads, there is a lot of burning which happens, not only within Uganda, but also when I travel to other parts of Africa, because I manage projects across Africa, you see a lot of burning which is happening on the roadside. And at the same time, people walk. Most of the time, they walk along the roadsides, and people are breathing in auto exhausts from the cars, as well as the black carbon, which is coming from the open waste burning. And there are no regulations on open waste burning, though we have a policy for Uganda where we have the environmental health policy, but the actual regulations to the community, they are not emphasized, or typically they're not there. I'm going to tell you a story about open waste landfilling. This is a true story. We have, in 1996, Kampala Capital City Authority purchased land in a place called Chitezi. And this was a landfill where the city collects garbage or waste from the city and fills it up at a specific location in Chitezi. It has been the normal routine, both the private waste management companies as well as the Kampala Capital City waste management team, they dump all the waste, not segregated at all, onto that landfill. So in 2005, there was the initial alert that the landfill is almost filling it up, is almost getting full. In 2008, a study was done, a research was done around the landfill, and World Bank as well as Ministry of Health alerted KCCA about the landfill being a problem. In 2016, the same alert was sent, and in 2004, last year, around 10th August, we had a landslide. So as you can see in the first picture, where we have a grader, there is economic activity happening on the landfill. The community around were using the landfill as their livelihood to actually pick up waste, which can be recycled and reused and sold for a living. In the next picture, as you see, the landfill looks normal, a normal hill. You could see it from a distance, and you see like it's a normal hill, that it's part of nature. Unfortunately, on the fateful night, last year we had heavy rainfalls. The landfill collapsed, and it was a disaster. It was a mixture of gases, a mixture of, I can't explain it quite well, but it's a mixture of gases which blast into a bomb, sort of like a bomb blast. And the communities nearby were affected and lives were lost. And people's homes and structures were destroyed. So, we have a lot of environmental hazards which are linked to open waste landfilling in Africa. We have the physical hazard, which I've just explained, where we had a landslide happening within a specific landfill. You can Google it and find out on the internet. The news was all over BBC, it was all over CNN. This open waste landfilling it's a chemical hazard to our communities, and as well as the air quality degradation to the communities around. But we do not have information, we do not have enough data to justify this. So we think that we need to conduct more research as well as put publications out there, first of all, to see what is the appropriated air quality issues around. Is it methane? Is it ammonia? Is it PM 2.5 coming around these landfills? Secondly, we need to work with government and other local authorities around in Uganda, but as well as the African continent, to have a open waste burning and landfilling act. Just as we have the Tobacco Act, which has greatly worked in Africa, we need the Waste Burning and the Landfilling Act to make sure that the communities know the regulations, as well as how best we could support the recycling process. Secondly, we need to put clear waste management strategies for each of the sectors. We have the health sector, we have the agriculture sector, we have the industrial sector, and also other sectors. And this includes how should the agriculture sector segregate their waste? How can the household segregate their waste? How can the industries segregate their waste? Then if we choose to go the road of landfills, then we need to monitor the quality of air around these landfills or any other technology which we would come up with to be able to basically understand exactly what kind of gases or what kind of pollutants around these landfills. More research is needed, and so to generate what kind of waste do we have in Africa, and what kind of research can be done, to generate clean energy from the organic waste, and how can we recycle the non-organic waste within the space of Africa. Thank you so much.
Well, that was a harrowing example. I think one of the things that my colleague Donovan Story, who is our waste expert at the Climate and Clean Air Coalition, is thinking about with like a large group of partners in the coalition is about rethinking landfills. So trying to make the actual landfill smaller and smaller and having, composting, biogas, black soldier flies, recycling facilities all around than just this tiny pile of last resort landfill so that you don't have these massive mountains of trash. With that, our next speaker is Bundi Haryanto. He's a professor of environmental health at the University of Indonesia, and he holds a PhD in epidemiology from the University of Indonesia and a master's degree in environmental health and epidemiology from UI and UCLA. He is an associate professor, former chair of the Department of Environmental Health, and head of research at the Research Center for Climate Change at UI. His research focuses on environmental epidemiology, particularly air pollution's health effects on children. He serves as a board of director of the Pacific Basin Consortium, vice president of the Indonesian Clean Emission Partnerships, and contributes to climate change and health policy development in Indonesia. So thank you, Bundi, and we look forward to learning from you about solid waste, air pollution, health impacts in Indonesia.
Ladies and gentlemen, good afternoon. It is my honor to be here. Thank you for WHO invited me to share about what happened actually in Indonesia, especially experiment of how to handle the challenge concerning the air pollution from the waste. And if we are looking at the background here, the picture, it is telling almost all of the things, the challenge, and how the government to respond this. And lucky me, because the previous speaker already mentioned all of this. But I should share what happened actually in Indonesia. Okay, as we know that landfill may cause the water pollution, air pollution, soil pollution, and natural environment. And some key points for Indonesia is actually that Indonesia produces approximately 175,000 tons of waste daily. we have around 270 million people, and 60% of which is mismanaged, leading to environmental hazard. Open burning and improper disposal contribute to the serious air pollution. And major cities like Jakarta that produce about 8,000 tons per day, with the number of population around 12 million. And also Surabaya, the second largest city in Indonesia, produce about 2,000 tons per day, with around 3 million populations. And Bandung, Bandung is a beautiful city. We call it Paris Van Java. So please come. It produces about 1,800 tons per day, with a population around 2 million. They are, of course, heavily affected of the wage and airborne pollutants from which significantly harm the public health. And if we are talking about the air pollutant sources from waste burning, we can see here that open burning, like plastic, organic waste, electronic waste, and landfill, which still using open dumping system, emitting methane, volatile organic compounds, and industrial waste incineration releases hazardous chemical. And already mentioned actually by the moderator in the beginning of these occasions, the key pollutant and their effects, especially from waste burning. We can see that particulate matter, PM2.5 and PM10, that may cause lung diseases, cardiovascular issues, and carbon monoxide, of course, because of the combustion, reduces oxygen in the blood and affects brain function. Dioxin and furans may cause highly toxic, linked to the cancer and immune disorder. While the methane and greenhouse gases, it will contribute to the global warming and climate change. And if we are talking about the impact of the air pollutant in general, we can see here that it may cause the short-term effect, like respiratory issues, asthma, bronchitis, throat irritation, and also eye irritation, like skin allergies, eye irritation, skin allergies, nausea, and dizziness. Well, for the long-term health effect, this commonly we say as the silent killer, because it may cause the increasing of risk lung cancer, cardiovascular diseases, birth defects, reproductive issues due to toxic chemical, and higher mortality rates in highly polluted urban areas. And if we are talking about what happened, the air pollution source from the waste burning, you can see here for the Jakarta cities. It's already been stated that Jakarta is among most polluted cities in the world. Not only in Southeast Asia. And the impact on health already been stated as well, reported high rates of childhood asthma and chronic obstructive pulmonary diseases, or COPD. Informal waste workers are exposed to the toxic fumes daily. And what actually the government initiative to tackling this challenge? It's there are banning open burning in urban areas, and also expanding recycling program and waste to energy plants. With the graphic, it's showing that the trend of PM 2.5 modeling in Jakarta. We can see here by using the data from 1990 to 2013, we do modeling to see what happened until 2030. And we can see here the trend of PM 2.5 still increasing if there is no any any urgent action. And the color represent of the source of the PM 2.5. And for solution and conclusion, proposed solutions, we already have the Ministry of Environment and Forestry regulations on roadmap of waste reduction from the sources. It contains promoting waste segregation and recycling to reduce open burning, better landfill management to minimize emissions, stricter regulation against illegal dumping and burning, and public awareness campaign for sustainable waste management. And for the conclusion, air pollution from solid waste is a serious but solvable problem. Government action, public cooperation, and sustainable waste management are essential to improving air quality and public health in Indonesia. I think that's all my sharing. Thank you very much.
Luckily, we have time for a little bit of Q&A with the speakers. I'm just going to grab my phone so I don't take us over. So, yeah, I think, we have a microphone. Pierre has, oh, yeah, perfect. So, yeah, I feel like this was a very rich, okay. Yes, perfect. So this was a extremely rich collection of presentations. I think that really gives us a really full picture on the health impacts from open burning and from landfills, and also gives us a positive message about the fact that this is a solvable problem, and that people are working on this, and that the evidence hopefully is going to inspire governments to ask for more support from the World Bank, from other institutions, other like African Development Bank and others who can really help deal with this large-scale problem. And so I think maybe what we should do first is turn to the audience to see if anybody in the audience has a question, and Pierre will bring the microphone. Thanks.
Isabella Nisi Maisano, NIH France. Many thanks, a very nice presentation useful. I want to extend a little bit because what we are doing in France is to have incinerators of a solid waste because there is too much waste. And the idea is to produce energy in some way. So the idea is that what combustion can be controlled, but this is not true because dioxin, ultrafine particle, etc., can be assessed out of the incinerator. So I would like to know your point of view on that because this is a second danger related to waste. Thank you.
Who would like to take the question on incineration?
No, I'm not. Can you hear? Maybe try again. Hello? Can you hear me? Okay. Can you hear me now? Okay. Yeah, I'm not expert on the topic, but what I can understand from the literature is that the technologies and that you need to apply to reduce the emissions, it really varies depending on the type of waste you are burning. And the big issue, it's the composition of these pollutants can be really tough to tackle. There are some studies from China showing that even the top technology, and we still have pollutants that can travel, persist in the environment and travel quite far. So it's always a trade-off from your government to what's the level of risk that they're able and willing to assume. And of course, the society to take that risk. But yeah, it's challenged, but it's everything's about monitoring and evaluating quite often and constant. That's my perspective. I don't know if my colleagues from the bank have more experience with this, have anything to add.
Okay, I just would like to share the experience in Indonesia, especially in the big cities. About 20 years ago, 20 to 15 to 20 years ago, we do the incineration for the waste, yeah. But then only about 5-year experience or 10 years experience, we stop it. Only the incineration only for incinerator only for the waste from the hospital. Yeah, only waste from the hospital and also from the laboratory. Why? Because in Indonesia let's see, the garbage. It's about 80 to 90%, and then rubbish and so on. The rest. So it means that when incinerator being running, yeah, this only effective to reduce the waste about 60%. Means that the rest of the garbage still need another management to dispose it. So yeah, right now the incinerator is not the choice for our garbage, yeah, in Indonesia. Thank you.
Thank you very much. Is this open? Global Alliance on Health and Pollution. We work on health and environmental issues, and thank you very much for opening the box of the chemicals in the air, in particular coming for open burning of waste and incineration. We have a lot of information. We have been working not only in Latin America, but in other countries. and collaborating in different UNEP negotiations, chemical negotiations. I remember when we participated of the Stockholm Convention, that one of the main sources of POPs to the air was the open burning in Latin America, and of course, incineration. We know that we have more sources that this of urban waste that are very, very worrying. We are using used tires as alternative combustible, and this is a very important source of pollution, not only of particles, but also of heavy metals. And now we know that we can mention nanoplastics, nanometals, and others. But also the waste from the petrochemical industry is burned. We have many productions of petrol in our region, in our Andean region, and we know that the waste is incinerated in local incinerators in very bad conditions. And this is also a very important source of pollution to the air. And the other problem that we really have in Latin America, in particular, and we share with Africa and South Asia, is the use and open burning of the cases of the used lead-acid batteries, containing more than 10,000 particles per million of lead. So we are talking here of a coalition, we may say, of sources that really pollute the air, that goes farther than the super pollutants that were mentioned this week here. And if we have to tackle all of this in collaboration with the other conventions, we cannot stop and continue talking about only air pollution. So I think that we share these problems with your region in South Asia and also with Africa. So I think that it's very important to open this box. Thank you very much.
Thank you.
Another question in the back.
Good afternoon. Again, sorry, Global Alliance on Health and Pollution. I want to do a statement and a question, actually. Can you hear me? We also work on open burning in Vietnam, and we have been sharing also results of our research and how to replicate this across other countries, including Uganda, where we collaborate with the Makerere University. But what we observe, and from my experience, is that it's good to have policy in place. I heard today we need policies. I also heard from the first speakers that you have a lot of people dumping into the waste to collect plastics. So of course what we observe is also that you have to create economic incentives for people not to burn the waste or not to interfere into the supply chain. And we have to create behavior changes. So this is what we have been working in Vietnam, and I wanted to share with you. We suggest alternatives to open burning, mostly to farmers, because we work on agricultural waste. And so how do we turn that waste into our resources for the country? And I think, the second speaker from the World Bank raised a very important topic. What is the economic model beyond this that will convince the country to enforce the policy? Because what I see is that even countries where the policy exists, enforcement is not there, and behavioral change is not happening, even though you train the people or you do the awareness campaign. So I'd like to ask you, what do you think we should be doing to change that behavior and that type of, attitude? Thank you.
Yeah.
That's a really good point and a good question at the same time. So on my journey to work, most days, I pass numerous signs that the city of Tshwane, which is Pretoria where I live, has placed, which has the logo, and it says, no illegal dumping. And right next to the sign is builder's rubble and a pile of waste. So you're right, it's about mindset and behavioral change. This is not the same as in a residential area where the waste is not cleared and they have no alternative besides dumping it on the community pile where most people dump what they need to get rid of. So even though in South Africa we do have things like it's illegal to dump in certain spaces, it's illegal to burn waste, especially in areas where people are residing close to those burn sites, there's very little enforcement of this, and that's a huge challenge. So how do we both incentivize people not to do it? I guess it's around job creation, small and medium enterprise, business opportunities for people to see that there's potential to make money and begin to generate something. That in itself requires support from government, and SMEs are often really challenged when it comes to starting anything in many countries, including in my own. But I guess the awareness raising has to start somewhere, and it's usually in the curriculum in schools. So there's work for us to do to make sure that we're teaching from a very young age the best ways to go about looking after what you've putting out into the garbage bin, and how to do the waste separation or biodegradable solutions and so on. But that at the same time is also a challenge because, you know, there's so many other pressing problems in low and middle income countries that, you know, is waste really a priority? So against these competing interests, we've got a great challenge ahead of us to ensure that we can raise this community awareness, but at the same time, let people see the value in doing things differently. And that comes with mindset change.
Thank you so much for that specific question. I think waste management starts at the household level. Actually, before it goes into to the government. I would think that we need to work with the community, especially at the household level. As programmers as well as researchers, we need to use the human-centered design approaches to co-create with the communities, understand their challenges as relates to waste management, and then co-create with the communities to see which solutions actually work for the community. Sometimes solutions comes from top down and they don't work at all. But if we let the community own their challenges and be in position to design solutions which apply to that specific community, I would think each community has their indigenous knowledge on how to manage their challenges. So I think we need to go back to the household level where waste is produced, first of all, if it is domestic waste. If it is agricultural waste, we need to go to the farmers themselves and talk to them as researchers, as programmers, and understand their actual challenges as relates to waste management. If it is industry, we need to go to them. If it is the hospital where the waste is being produced, we need to go to the hospital and talk to that specific nurse and understand how the nurse is managing infection control, how they're managing the waste, and be able to design solutions at that level. I think that's when we'll be able to solve some of these solutions in the simple way, in the most cost-effective approach, as well as using low-cost solutions which are applicable, acceptable, as well as indigenous to the community. And there is that community buy-in that we need to deal with right now. Thank you.
Thank you, Agnes. And I think unfortunately, we need to wrap. I'll let you say the second to last word.
No, I just want to add that, yes, I agree with what my colleague said, but at the same time, you have a big challenge for the communities because in reality, if you go to these places, they don't have rubbish collection where they are going to put the rubbish. So yes, we need to have awareness, we need to have support, we need all these things, but you also need to have the infrastructure. You need to have the investment, otherwise nothing is going to change. And you are talking about people who are at really low income that need to really scavenge and try to have some income to survive. So it's not that, it's not only about education, it's about also providing the means for them to change the behavior. It's not that easy from my perspective.
Okay, so with that, I'll just say my final word, which is that listening to all of the comments and the questions, it really makes me also think that it makes me think about how hard behavior change is. And I would just encourage for everyone who didn't raise their hand to household composting to really like commit to it, challenge yourself to take it on as a personal commitment. And then I think you can be even more strong going out into the world and like trying to encourage behavior change on a much more massive scale. So it starts with every individual, and then we all have to like do our part to push against this massive, pile of trash, literally, and really create this change. So thank you, Pier Paolo, and thank you to all of our speakers for a super rich afternoon, and yeah, for the questions.